Next, we're going to do hand placement of the skull. And I'm going to have both apprentices also put their hands on the skull so that it will help you to understand things if you have questions. I first want to say that all the credit that I am teaching you goes to the Upledger Institute, Dr. John Upledger. But what you're getting with me is in the integrity of what John has taught. So after you do all of the other preliminary things, then you can come up to the skull. There's a thing called the vault holes. I'm going to do a little very quick showing you where to place the hands. It's kind of a vault hold thing, but you don't have to spend much time there because as soon as you do the vault holds, you are going to be starting to do the treatment. So it's up to you if you want to use the vault holes when you start or if you want to just eliminate them. It's not really critical one way or the other. Sometimes you can get kind of a global feeling of what's going on and then you can zero in on it. But if you don't do it, sometimes I do it, sometimes I don't. And I've gotten to where I just kind of globally do it and cover the bones that I need to do it without doing all three of them. But the one vault hold is where your hand is underneath and then the other hand is on top. And you're also covering up that suture along between the frontal bone and the parietal bones and then the two parietal bones. You're covering the suture back here between the occiput and the parietal bones. So you're feeling what's happening between those sutures. And you just kind of hold your hand there and there, top and bottom, and you just kind of feel what's happening. Is one side higher than the other? Is one side twisted a little bit? How are they fitting together? Then you go to another vault hold, which is farther back, where you're kind of on the sphenoid bone, but a little bit more on the frontal bone and behind, and you're going across these sutures here. So you're feeling that happen. And then you're just kind of, again, you're feeling for the suture placement. And that's the bone to bone, because those are the bones that move. They move together. They move with each other. And you want to just kind of get a feel for that. And then the third one is a little bit higher on it, where you're turning your hands this way, and you're on the sphenoid bone. And then you're mostly on the parietal, and you're also on the temporal bones, which is the brown bone. And then you're feeling those sutures there and how they're reacting and how their rhythm is, because you'll also feel the rhythm that we just have gone over previously. So you'll feel kind of a rhythm happening too with that. If you stay there very long, you can also, the bones will begin to correct. But that's okay if you're running short on time. But it's better to take each bone for itself and let that bone correct itself along the suture lines, because there's more depth to it and it gets deeper into the system. So the first bone that we want to open up is the frontal bone. It's this kind of yellowy color bone. And by doing that, this is the eyebrows, and there's a little hook there. So you take your ring finger and you place it right there on each side. And unfortunately, this little head doesn't have much to hold him up, so he kind of rolls around. And then the beginning courses that we've taught were just to have the fingers on top of the frontal bone, so across the forehead, more or less. And what you're going to do here is you're going to have light cellophane type hands and very light, 5 grams of pressure, and you meld into the bone. In other words, you feel like you're melting into that bone, and then you want to intentionally have that bone go upward. So you're going to feel the bone starting to rise a little bit. Now, sometimes it'll go, it'll do that. Sometimes it'll just rise together. Sometimes it raises so much that I used to think I was creating a unicorn horn on somebody's head because it was going so far. And that person may have had a couple bumps on the front of the head. And you just wait and you just feel that going. So you place it on top of the forehead there, the fingers, and with that hook. Now you don't pull it up, you don't really pull it up. You're just like magnetically holding on to it, and then just with a little tiny, tiny, tiny lift to start that happening, and then the bone will start to do what it needs to do to separate from the suture and correct itself in any other position. Sometimes it'll feel like it might kind of, I call it a screw cap, because it'll feel like it's twisting a little bit. But it'll do what it needs to do, and then just follow it. Follow, if it starts to twist, just follow that twist till it stops, and then it's going to change direction back because it unwound something, and then you'll just follow it back. Now bear in mind that the dural tube is right underneath that bone, and it is attached to various locations on these bones. So that's something else you can take a look at if you have an anatomy book or whatever you want to do. Now as I advanced, I understand a little bit more about the whole frontal bone, so I tend to want to lift the frontal bone a little bit more. I would say start with this until you're comfortable with it, and then what I do is, I'll show you with one hand so I can hold him, is I get that in the position, but then I bend my fingers around, and I do not go down to the suture line, but I'm on the frontal bone. And that way I get a little bit more grip onto that frontal bone, and I can pull it a little bit. And it's not really a pull, it's that kind of that urging it upward, and I can feel a deeper pull. I have to use that word because there's no other word, but a deeper opening of the frontal bone away from the suture line with the parietals. So if you start out just using the top till you get the feel for it, and then if you want, you can bend your fingers back so that you're more on the frontal bone, if you can see that, and then you've got a little bit more of a grip. You're melded all the way, you're melded. So with two hands it would look like this. So the hands would be bending back. You have to have pretty, your hands have to be kind of flexible at this point too. And they have to be working really nimble, like nimble fingers. So that way you just get a little bit bigger feeling of the lift of the frontal bone, and it does go a little bit deeper. But if you just are comfortable with this, just do that. It's going to do the same thing. You're going to still get changes. But as you advance and you want to take it a little deeper, just don't grab it and pull it up. You just urge it, give a little, just like a little urging to go upward, and then back off. And just be in neutral energy. Don't push energy in, don't pull energy out unless it's real stuck. And just let the bone find its way where it has to find, and just follow it. So if the bone's coming up and it's twisting a little bit, just follow that bone twisting, and then it'll come back. It's unwound something, probably in the dural tube, and then it'll lift up even more. That's usually what happens. It'll even lift up even more. So you can try that out. The second bone, I'm going to do a couple bones, and then we'll do these two bones, and then we'll have you trying it. Now the second bone, what we're doing, this is the parietal bone. We want to open up this area here. This is the temporal bone, and this is the parietal bone, and the sphenoid bone is also connected into that. So we're opening that space, so the sphenoid bone has a lot of different positions. So and you don't really feel a rhythm with the frontal bone. You just don't really feel a rhythm. You can feel a rhythm, but I usually don't look for the rhythm. I just really want to see that bone separate and pull and open. So the second one is you go straight up from the ears, the ear hole, and you draw it up. And there's a little tiny ledge, like a little ledge on the bone. It's just kind of, it comes up and then it feels like it, I don't know, makes a turn. But you want to be just kind of below that ledge, and you want to be right above the ears. Now this one, what you do is you take a little bit of you put your thumbs together behind it, and then you take a little bit of a squeeze, just little tiny, because you're opening up these sutures along here. You're opening all those up for the parietal bone. The temporal bone and the parietal bone where they come together. So it's a little tiny bit of a squeeze, and I always wait to feel some kind of a little rhythm happen. When I feel the rhythm, then I know that I've like taken the anchor away from, if it happens to be anchored onto the temporal bone. So there's a little flexion and extension that you might feel. And then once you feel that, then you want to gently urge the bone to come upward, like the top of the head upward, not front upward, but top of the head upward. And you want to just gently have that magnetic kind of merging of the hands and the bone, just lifting that a little bit more. And so then what that's going to do is that's going to open up these bones. Now there is another suture here, but we don't have to worry so much about that. You just want to lift that up so you get the opening there. Be sure to have your thumbs together, and the reason the thumbs together is so you don't get crooked in the way you're doing it. So your hands are equal so that both parietal bones can pull, can open up, can go upward, superior, together. And because it's the gentleness, because you've squeezed in already, you are opening this a little bit anyway. So then you're just squeezing in. This will open because the bones are going in. This will open a little bit, and then you're pulling it upward. So there's that. Okay, let's give it a try. And it's setting down here. This is how the head would be in the position. You might want to sit down and scoot your chair forward. Yeah. Now, take a look at where your fingers are. They're right over the eyes. Yeah. Yeah, that's better. And then just feel, it's over the sutures. Over the sutures. Good. Yeah, now these fingers back here would want to be one on each side of the vertebrae. There and there. Yeah. Yeah, that's the position. Yeah. And then the head is going to their head is going to be more like that. Yeah. And so that's to feel all the sutures. Yeah, that's good, the better hand placement. And it's very light again, very light. The only pressure is at the weight of the head, but you're not pushing into the head. Yeah, that looks good. Yeah. Uh-huh.
And the second one was
kind of underneath. Yeah. Good. Yeah, you're covering it all.
okay.
Yep. That's good. Yeah. And again, the head will be more like that. Yeah. And that's good. And then the third is where you're grasping, all of and you have your sphenoid bone. Yeah. Good. Good job. And then that way you're just feeling what's happening. You're not taking it in any direction. You're just feeling it. And that'll give you clues as to what bone probably needs to be worked on as well.
So that's 3.
Yeah.
3 positions.
And then the frontal bone, I'll hold him I'll pretend like my finger, here's his spine.
So just one hand goes on the front.
For the frontal bone, no, you hook in the little hook by the eyebrows with the ring finger, Yeah. And don't touch the sphenoid bone there. You just want to get the finger in the hook right there. Yeah. And then lay the other fingers across there and start by lifting straight up so you're not cupping that yet, so that you just have it across the eyebrows and the forehead, and then you'll be gently pulling upward with that. It's a kind of more energetic, but it's melding to the body too, so you're affecting the physical, but it's not in force or in pushing too hard. It's not pushing, it's more energetic, but it's engaging with the physical body as well as using a little bit of energy to urge that up. But you don't want to get too much into the energy because this is also physical work. So you have to come to that fine line of subtlety between the two, the energy and the subtle part.
Right.
Yeah, it's just a little bit different frequencies. And then the parietal bone. And then you can also practice on that frontal bone to just bend your fingers around, when you're ready for that. It'll come more natural. Now the parietal bone, remember, you come up from the ears and you slide your fingers up to the green bone, to the parietal bone. You want to slide it up. Here's the ears. You want to slide up above the, yeah.
Just use the ear as a guide.
Yeah, as a guide.
Okay.
Yeah, that's right.
Okay.
And then, yeah, so you just find it, because you want to be sure that you're not too far forward.
Right.
You want to be on the parietal bone. So there's the ear. Where's the ear? Right there. So it would be right straight up about here. And that's where your fingers would be on that little bump. There's kind of a little bump there. And you want to be just right on the edge of the bump. Because you don't want to be on the temporal bone.
Okay.
Yeah, that looks pretty good. And probably pull your fingers a little bit more together on this one because it's getting awful close to that suture. Yeah, good. And then just, let's see, is that going back? Yeah, keep your fingers a little bit closer together so you're more like this on that part. And then you're just kind of squeezing together, but you're not really squeezing. Mm-hmm. You're just opening. Now here, your fingers are they're too close to that, the temporal bone. So you want to lift it up a little higher to the edge, that ridge. There you go. And bring that up a little bit higher to the ridge. Yeah. Yeah, you want to be farther away from that. And then take a little bit of a squeeze, but it's not really a squeeze. It's just a little pressure in to open up the suture, and then pull, and then once you feel like that squeeze happened, it's a squeeze there, so these bones here are opening. And good, your thumbs are together, that's excellent. And then just pull toward you. It's like a little nudge, and then you feel like it's lifting, like you're making two horns coming out of the head. Mm-hmm. This one you make a unicorn horn, that one you make cow horns.
Okay.
Yeah. Awkward, in a way. Okay, Peggy, let's give it a try. This is the position they'll be laying on. It's one hand under like that,
Mm-hmm.
and then the other hand's on top for the first vault hold.
Mm-hmm.
And then that whole hand needs to be down, feeling all of the sutures. Yeah. And you're just feeling sutures here, you're not directing anything anywhere. Yeah. It's the way it feels, good. Okay, and then
Back under.
you're kind of back underneath, yeah?
With the same hand.
With both hands.
Okay.
And then spread it out so that you're covering more space there, but you're not necessarily on the sphenoid bone, but you're covering more sutures. You're covering all of those. You're covering a little bit of the occiput and the parietal and the temporal, and then you're also on the frontal. Yeah.
And that's okay to right here for
Yeah,
now?
yeah.
Okay, this one?
Yeah. You just don't want to really be on the sphenoid bone. You want to move that one up there, kind of scoot your hand back a little bit. Yeah. There. And cover this bone too. Yeah. Bring your hand so that you're covering that. There you go. And then this needs to be on the occiput. So lower your hands down just a tad. Yeah, There, that looks good. Yeah. Yeah, that looks good. And so you're covering all those sutures with the blue, the green, the brown, and the green. Yeah, I said that, and the yellow. So you're covering those sutures. Yeah. And then the last one is higher up on the skull. Of course, and the skull was like this, so your hands are going to be in an odd position. And this one you have your hands, this one is going to be more where your fingers are like this. You're covering these sutures, but you're also including the sphenoid bone on that. And here's that's pretty close. Yeah, you're not really paying attention to this bone. Yeah. And spread that out. Yeah. So you're very, very light on the head, even though this head you have to kind of hold. But the head position is going to be back like that. So that's the other thing you want to remember, where the head is, how the head is. Good. So now you want to do the frontal bone lift. And that's where you find the little hooks with your ring finger. Mm-hmm. And now you want to be careful not to get onto the sphenoid bone. It's a little tiny hook right by the eyebrow. And then, yeah. And then just fingers there, and then start by just having your fingers on the frontal bone without curving it down, because that takes another, you kind of got to rest your arms down and just straight, yeah. Because then when you're going to do the more advanced thing, then you'll just bend your fingers. Your fingers will curve down so that you're going to the pads right below the fingers. But that's a place to start. And then you just want to feel like you're lifting the bone upward and make very light pressure. Yeah. It would be superior, or front, lifting it forward. Yeah, that's pretty good. Yeah. Okay, that's, yeah. And then the parietal bones coming up from the ear. And now you want to go up to the parietal bone. You want to get off of the temporal bone. You have to go all the way up. That's just a landmark to get up to that little edge. But it's above the temporal bone because you're opening up the temporal bone. Let me see. Let me put the head back in. Yeah, okay. So
3 fingers?
you turn your hands like this. Yeah. Yeah. So, yeah, and keep your fingers closer together. And then you feel a little bit of an edge it's about right there. Some heads really have a big edge, some heads don't. But you want to be above these sutures. Now, because then you just take a little push inward, not much, but just a little push so you can open up these sutures. And once you do that and it feels like it's open, then you pull toward you. I can't see that you don't have, the thumbs are off. Yeah, the thumbs are off for that it's just to balance the hands. But you're not necessarily, yeah. That looks pretty good. How's that side look? That looks pretty good. Yeah. Yeah, that looks good. Yeah. Yeah, this is going to be awkward at first. That's why if you can just get ahead and just kind of because this is the order too. 1, 2, sphenoid, 3, 4. There's 3 positions in this. There's several in this. So that's how we open them to get to that. So now that we've got this pulled up, so the sphenoid bone is open. This is a sphenoid bone. So it's, here, we'll look at this one. The yellow bone. So we've opened up, this is different colors, but we've opened up the parietal bone, which is green, this little part there, that's been opened up. The sutures for the temporal bone, which is pink, have opened up. And the frontal bone, which is blue, has opened up. So now the sphenoid bone is able to actually give a little bit more pumping action. This is what pumps the cerebral spinal fluid right here. So when that starts getting compressed, then this isn't going to move very much, and so you'll feel a slower rhythm or something. Does that make any questions? Does that make sense? Okay. So now on the sphenoid bone, this we're going to do a flexion and extension. So this is where it's important. You have to anchor your fingers on the occiput, because the occiput works with this, and if you don't have it anchored, then it's just going to move with it. You want the anchoring there so the sphenoid bone can move freely. So you take 2 fingers and you anchor, and then you take the thumbs and you find that soft spot on the forehead or on the side of the head. It's called the temple, that where it's soft. And that's where the wings of the sphenoid bone is, these wings that come out. That's the bone that you're going to want. That's how you're going to access it. So you anchor, and then you put the thumbs there. And then to start out, you're just going to move, you're going to hold it very lightly, and then you're going to wait for it to feel like it's going forward, like towards the feet, and then backward. So this bone is going to go forward and backward. And that's the flexion and extension of this bone. That's why it's so important to get that rhythm. Now what you're going to do is just watch for the symmetry and all that with this bone. And so that is one thing that you're going to do. And then I'm just going to show you the second part. There's other positions to do, but I want to wait on that one because I want you to be real comfortable with this. Then the next one is that you're going to just do a little compression where you just kind of like urge the bone down, but not with any force, because otherwise, because it's a compression, so you'll be compressing that into the occiput, but you just kind of do a little compression and then decompression where you turn it and you draw it up. And then when you're up there feeling that, you can find the rhythm again, and that's going to be a little bit more open. So technically what you're doing is you're anchoring, and you got the sphenoid bone here. Okay, and you're anchoring. This is kind of hard to show, and this is the fulcrum of the body as well. So this is the balance of the body. So you're going to feel this flexion and extension, back and forth. And then you're going to compress down. It's kind of like when you have a cabinet that you have to push in to pull out. So it's a quick little compression down and then decompression going upward. And that's going to give you just 2 things. There's also other things to do with the sphenoid bone, side bending and torquing and also shearing. But this will give you enough to open it up, and then you'll feel a different rhythm as it's being decompressed. And that can align it pretty well. When you get a little bit farther along, I'll show you that other stuff, but we have to have this really down well so that we don't shear it in a direction and then leave it there, because that's a big problem that oftentimes happens. Christy. Anchor the fingers back here.
In the blue?
Yeah, take those 2 fingers like that and anchor, and then bring the thumbs. And you don't really touch the other parts of the head. It's just the anchoring and the sphenoid bone, and the hands are away from that. Just keep those fingers there, and then curve your hands around and bring that to the sphenoid bone. And that's the only place you touch. You want to have space in through here, because otherwise you're going to hold bones down. So yeah, that's perfect. Yeah, you got it. That's it. It's very awkward. And then you're just going to feel for this flexion going forward. The sphenoid will do it, and you just wait for that rhythm. It's a flexion and extension. And so you just feel for that rhythm, flexion and extension. And then you want to keep that bone, and then you just draw it straight down to the table just a little tiny bit, and then reverse it and lift it upward, like toward the ceiling. and that will open up that space, and then you hold a little bit longer and you feel a flexion and extension. And that's the hand placement. Yeah. That's very good. That's the perfect hand placement right there. So your hands don't touch the other stuff you're not wanting to move. Okay, Peggy? Awkward, isn't it? I mean, it's really, but once you get it, you get it. And once it clicks in, it's there. And, it's so natural then. Okay, here we got the same kind of issue. You're going to have just the anchoring of those two fingers. You're off the bone here, and your thumb will be there. Yeah. It's these two fingers. Yeah. Let those just hang loose. They get to just relax. And that's the other thing, is you want to keep your hands relaxed. It's those two just on the edge of the occiput, and then move the hands away, or this hand. Yeah, thanks. And then put that thumb on the sphenoid bone and let the hands relax. That's the other thing I didn't mention with Christy. Just let hands relax. The hands have got to be really relaxed. And then you'll feel the flexion. You want to get this one a little bit more on, yeah, there you go. Feel for that soft spot. Sometimes you just kind of feel, until you feel the soft spot. But you know where it's at because of this model, this head model. Then you just wait for it, and it'll go towards the feet, or it might go the other way first. It doesn't matter. It'll flex and extend, and flex and extend, and it'll be just the bone itself moving. This will be the only thing that's moving. It'll be moving. That's in the mouth, so it'll be moving this way and that way, and this way and that way. It's also moving inside the mouth. Yeah. So that one is going to take a little practice. And then the temporal bones, I have a different way of doing the temporal bones, and I'm going to show it this way. This is the mastoid process, is hanging down part of the temporal bone. You just cradle the head in there, and then you take your hands, your thumb, and just kind of let it squeeze inward, and then let it come out. And this is where it's going to be really tricky. This is a tricky one. And then you squeeze in, but you don't really squeeze. You just follow. That's a rhythm again, and out. That's the natural rhythm it's supposed to be. Then what you're going to do is you're going to take one of the thumbs, and you're going to you put a drag on it. In other words, you're just going to hold that bone while the other bone comes out. So you're holding this bone, and this other bone is going to it's going to open up. The rhythm is going to take it outward. Then you do what's called a temporal rock, and then you rock that back and forth. So this bone will be pushing in, this bone will be pulling out. This bone will be pushing in, this bone will be pulling out. This bone will be pushing in, this bone will be pulling out. And it'll just go into a temporal rock. It's not the natural way it's supposed to be, but it's opening up more things. Then you just take a drag on it again, where you hold one of them tight. If this one's out, you just wait till that one comes back in, and then you let go, and then you take it back to the natural rhythm, where they're both going in and out at the same time. So that's step one on that one. Step two is where you put your fingers inside their ear, the long finger inside the ear, and then you place the hand, one on the mastoid process, and the other one on this little part of the temporal bone that's real thin right there, going into the cheekbone. Same kind of thing. This is going to be a forward move and a backward move, because the temporal bone has different motion. This is with the rhythm, forward and backward. Put a drag on one of the bones, on one of the hands, take that forward, and alternate, so it goes opposite direction. And then hold that one down when you're ready to take it. I just do it like 2 or 3 times, and then let the other one come out and meet it, and then you go back so you're in the rhythm with both of them. And that's That's number 2. And then number 3 is where you take the inside of the ear and on each side, and you'd very gently kind of pull it kind of out and up, kind of in an angle. And it's not a pull, real hard pull. You want to think that you're pulling the membrane inside of there. So it's a real gentle ear pull that you just feel. And sometimes when you do the ear pull, you're going to feel these bones just going crazy because they're aligning while they're getting more space. So that's the temporal bone.
I don't remember anything.
And so you want to put a hand on the mastoid. Yeah. Let's see. Let me think. Let me see. How did I do? Yeah, with your thumbs. So you're going to hold it like that with your thumb on that. Yeah, that's it. That's it. And then so that the rhythm will take you in, and then the rhythm will take you out. And that's good hand placement. That's really good. In and out. And then you drag it, so you hold one in while the other one's coming out, and then you wobble it and let it go back and forth like this. So it feels like it's going in, like,
Yes.
yeah. And then you hold one in while the other one comes in, and then you let it go, and then you come back to the rhythm, the natural rhythm. Yeah, good. And then the next one is the fingers, the long finger in the ear, which the ear is right here. Yeah, you stick it. You don't go way down into the ear. You just go, just there. Yeah. You don't, people like this temporal bone stuff. A lot of them do. And then, let's see. It's always hard to look. Finger in ear. Yeah. Now your hand, okay, you're almost there. One is, that's on the mastoid process. This one should be a little farther back because you're right at that suture. You don't want to be at the cheek suture. Okay. So you want to be right there. Yeah, and the finger in the ear. Good. Then this one is the rhythm is going to feel a forward. Good job. It's going to feel a forward and backward. This finger in the middle shouldn't be moving. It's the bone around it. So it kind of goes like that, if that makes sense. Yeah. And then you do the same thing where you put a drag on it, hold one in one position while the other one moves out, and then let them go opposite. Yeah, and be careful not to get too much other hand on the thing. You're pretty much just on those bones, so keep space in there. That's one thing that when you work in individual bones, you really don't want the other hands to, because they'll hold down the bones a little bit. And then you put the drag on that, and then you get them to go back to their natural back and forth, or forward and backward. That bone, it looks like a little gill when we're in utero. It's like a gill. And then, of course, it develops into a bone, but it kind of acts like a gill. That's why it does these different gill-like things. Okay, and then the ear pull is just that he doesn't have ears, so you just want to like grab it like that, and yeah.
Just using your middle.
So the ear pull is right where the big part is, where you can put your finger real easy.
Index finger.
Yeah, and then you go behind that, and you just pinch very gently, and then you just give it a. It's kind of a pull. It's not really a straight pull out. It's kind of more like the way a cat's whisker would be. So it's kind of a back pull. And you'll feel that wiggle around. So if we just follow the wiggly. Yeah, that one's probably the easiest of all. Okay, Peggy. And then that is pretty much the bones.
Beautiful.
Except for the jaw. And that's it. Okay, so you start with the you want to have the hands underneath and the thumb on the mastoid process on each side. And so you're cradling that. Yeah, get your hands underneath, and this one you let the head lay in your hands. Right, perfect. Okay, good. And then that's going to be here. That mastoid process is lower than that. But you don't want to have Yeah, and you want to have somewhat, you don't want to have a whole lot of, well, they're laying on your hands, but you, yeah. So the mastoid, yeah, there's the mastoid process, and yeah, and these hands are just kind of, yeah, just kind of there, but they're just relaxed, so that you're not really doing, the head is just the weight of the head.
Is resting on the fingers.
Yeah, and his head will be like that. So then you feel an in
On the altar. On here.
and out together. It'll go in and out, and not very far, but that's, yeah. And then you hold one in while the other one comes out,
An altar.
and then it's called the wobble, temporal wobble. And then you hold one either side. You can hold it in or out, but I usually hold it in until the other one comes in, and then you go back to the natural rhythm. Yeah. And then you take the the long finger, and stick it in the ear. That's the same part of the ear that. That's the jaw. A little higher, like right there. Yeah. It's right behind the jaw joint, kind of. Okay. And then, so your finger's in the ear. One will go here, and one will go on the mastoid process. So that one goes there, yeah, and then this one has to stretch down to the mastoid. And you want to have space between there. You don't want to clasp the head on that one. And then you let it, what it's going to feel there is it's going to feel like the rotation back and forth. And wait a minute, this is there, you're there. Yeah, that's a bone that sticks out. Otherwise you were going to be on, pretty much on the sphenoid bone. You don't want to be there. And you don't want to be too high, because then you'll be on the cheekbone. So you just rotate, rotate, and then you hold one side in the rotation and let the other side move in, and then the other side, so it's alternating, so it feels like it's going opposite each other. And then you hold one side, and then you catch the other one up, and then you move it the other direction, and you rotate and rotate and let it rotate. And then when it's back to that rhythm, then you can pull out and do the ear pull. So there's two positions that I showed you on the sphenoid bone, which is the flexion extension, the natural rhythm, and then the compression decompression, and then you're going back to the rhythm. On the temporal bones, there's the squeeze in and out, and then there's the wobble, and then the back to normal, and then there's the rotation, drag, opposite, and then rotation. So that's kind of tricky, and don't worry about it. Just, if you have to write it down a little bit or something, but just keep practicing it, and pretty soon it's right in your hands, and it's like there. It's always awkward at first when you're learning something new in the hands. And then the final one, which isn't really related to the cranial system, but there's a little dip in the jaw. And what you do with the jaw is, see how the jaw is kind of at an angle. You put your hands, you can just put them very, very lightly on the skull, but not too much pressure. And you just pull, like let the jaw come up. So it's pulling the jaw this way, and then you come to the outside of the jaw, and you just extend it down that way. Now what happens is when your hands are very light and very close, sometimes you feel a massive amount of shifting in the temporal bone from the jaw. It's like because it's so close in proximity with that joint that it does that. So it's a very easy, it's not part of the cranial system, there's no rhythm to it. You just in, up, and then flip, and then just down. But take it it's kind of a curve. It's kind of like a curve and a curve. And that one's very easy to do. Well, at least after you get practiced. And it's underneath, first your hands will go under. You'll feel that little, so you just kind of rub your hand along the jaw, your finger along the jaw, you'll feel a little indention. Just kind of take this along like here. Do you feel that indention? Yeah, okay, that's where you want to be. And then just, yeah, and then it's just kind of a upward kind of, I hate to use pull and push because it sounds so big. And then you just take these fingers and just flip them to the other side. And then you let it open the jaw down. It's another cabinet push. It's another one where you push the cabinet in and let it out. And that's very relaxing, very, very relaxing. And when you get into mouth work, then that is the part that's got to be opened. You've got to, the mouth work is fun too. Okay, let's see. Yeah, get your hands kind of there. It's more like this, Peggy, where you're on the jaw, you're kind of like that with this ring finger.
Mm-hmm.
Yeah, and then this little finger sticks out, yeah. And then these relax the hands on top. Part of it is really remembering to relax the rest of the fingers, and then just kind of feel that kind of a pull. It's kind of a curved pull up, and then you just flip because his jaw will probably be not too open, and then you just flip the finger from the, yeah, just relax the hands. Don't lean them so much on the head, and then bring that finger to this part there, and then on both sides, that's where and then you just extend that down. So you're opening that jaw area. Sometimes that'll correct people's mouths to a degree. Oftentimes you do have to go inside.
And he did once.
But yeah, just practice. If you can get a skull, they're kind of pricey, but or just grab a head and work on someone's head. But yeah, very good. You did excellent today, and I thank you for your attentiveness and everything that you've done. So, thank you. I want to invite you to explore my course, The Foundations of Subtle Alignment. In this course, you will learn about the subtle anatomy and a protocol for assessing and aligning the subtle structures.